Mr. Mayor, we're over here. So good afternoon. Today we're going to be discussing in detail how we're working with our colleagues in some of the highest risk communities to help them and us deal with COVID. And those communities are Chelsea, Everett, Lawrence, Lynn, and Revere. I do want to give a quick update first on the COVID numbers. At this point, over 2.4 million tests have been administered by the Commonwealth, and over 1.7 million individuals have been tested. Yesterday, there were over 15,000 new individuals who were tested. Testing continues to increase statewide. Last week, the Commonwealth conducted an average of about 33,000 tests a day, which is about a 20% increase over the previous week. And we continue to urge residents to get tested if you feel sick or if you feel sick or you were in close contact with someone who has COVID-19. Many of these tests can be done through our Stop the Spread program, where free testing is deployed strategically to high prevalence communities. Since its launch, the Stop the Spread program has increased testing per capita in these communities by more than 100%. We're also seeing younger people get tested at higher rates, primarily in preparation for school and for colleges. For example, last week for the 16 to 30-year-old quadrant, there were 1,000 tests conducted per 100,000 residents. That's a number that's tripled since early August. And the state's average test turnaround time for test results has continued to drop, even though we've been increasing our testing. Turnaround time for August was about 2 days. That's down from an average of 3 days in July. The Commonwealth as a whole has made a lot of progress in fighting COVID, but a closer look at the public health data shows us that a handful of communities have persistently seen higher case rates and transmission. We know that COVID can and will spread quickly in any environment if swift action isn't taken to slow and stop the spread. To take a more aggressive approach to dealing with COVID in cities and towns where cases are higher, we've launched a COVID-19 enforcement and intervention team. And these teams have been working closely with leaders in high-risk communities to help identify what's causing the high rates of COVID and how the state and they can work together. These initiatives are a partnership between our administration and local officials and include law enforcement, boards of public health, and local community organizations. Currently, our public health data indicates that Chelsea, Everett, Framingham, Lawrence, Lynn, Revere, West Hampton, and Winthrop are high-risk communities or red communities on the map. All residents in those communities really ought to stay home if they feel sick, and they really do need to get tested if they go out. No one can afford to gather in large groups in these communities. This is critically important. Time and time again, as our contact tracers have reached out to and engaged people who've become infected, gatherings, unsupervised, unofficial, people being familiar with people they're familiar with, play a major role in the spread of COVID generally in communities around the Commonwealth. People still need to remember to do things like washing their hands, and of course, they need to wear a face covering if they're going to be outside and they don't have the ability to distance. Everyone in communities that are shaded red on that map really needs to go above and beyond to do their part to stop the spread in their own community. And today we're announcing a series of new tools to ramp up enforcement, education, and public health in the 5 communities that have experienced persistent, dangerously high transmission rates. And those communities, as I mentioned before, are Chelsea, Everett, Lawrence, Lynn, and Revere. This will also include a campaign in multiple languages and will be done in conjunction, as I said, with a number of local officials as well as community-based organizations. The goal here is to make sure people understand what's going on in their community, where resources are available, and what they can do themselves to help stop the spread. It includes, among other things, a new website platform, mass.gov/stopcovid19, advertising on billboards and digital and social media, downloadable materials available in multiple languages, multilingual field teams deployed in these communities, phone and text communications, and outreach to local community groups. The new website at mass.gov www.commonwealth.org/stopcovid19 will allow residents and business owners in these communities to get more information and download materials that can be displayed in their businesses, apartment complexes, restaurants, and other community organizations. People have the power here to save a life, and everybody needs to do their part to stop the virus. Secretary Sutters will go into more detail on the campaign shortly, and Mayor Rigo from Revere is kind enough to join us today to speak a little bit about this with respect to his community. I think through the COVID Command Center, we've expanded free testing resources in these communities and will continue to do so wherever needed. We've also assisted local boards of health with contact tracing resources, and we understand that many of these boards are working tirelessly, and we're augmenting their efforts. We're also addressing food security and housing needs in these communities as well, continuation of work that's been done over the course of the previous 5 months. The Executive Office of Public Safety and Security and the Mass State Police are also working closely with the ABCC and local law enforcement in these communities to monitor and issue fines to businesses and break up large gatherings that aren't in compliance with state guidelines. We've developed materials that law enforcement can distribute to groups that are not in compliance with these rules, reminding businesses and individuals of the guidelines and the potential fines associated with them. Sam Phillips is here from the Mass Emergency Management Agency to speak more about the important work that law enforcement's doing in these communities in a moment. Before I turn the podium over to Secretary Sutters, I do want to mention a quick update on school reopening. Over the past few months, we've worked with our colleagues at DESE and in local government to lay out detailed plans to help get kids back to school in almost every community in Massachusetts, where local COVID transmission rates are well below recommended levels. And we've provided over $1 billion to local communities and schools to make the necessary adjustments that they need to make to their schools. Now, as students head back to school, the Department of Elementary and Secondary Education is launching a public service campaign to help remind parents and students and teachers that we all have a responsibility to keep each other and our communities healthy and safe. We can return to school safely if we all do our part. The campaign consists of television, radio, and mobile ads, billboards, ads on public transit, as well as a new website created to help families find information that they may be seeking about going back to school. The website for this one is mass.gov/backtoschool, and will give families information about why doctors say most communities in Massachusetts are ready to return to school safely, what schools are doing to promote safety and mitigate risks, and how to stay connected to accurate information on reopening and COVID-19. The campaign's one more additional tool to help raise awareness in our communities on the ways that we can help to do our part to push back against the virus. And as people have heard me say many times over the course of the past few months, COVID clearly doesn't and won't and didn't take the summer off. And for the most part, people around the Commonwealth did their jobs this summer by wearing face coverings, socially distancing, and keeping their gatherings small and manageable. As we head into yet another holiday weekend and our back-to-school season, it's important that all of the Commonwealth's residents stick to these proven practices. COVID is highly contagious, and it's going to be with us until we have a treatment or a vaccine. Everyone needs to continue to take it seriously and not let down their guard. You can do your part. You can help protect yourself, your loved ones, and your community from COVID by wearing a face covering, socially distancing, washing your hands, and recognizing and understanding that this virus will spread if you give it the opportunity to do so. So let's all have a nice Labor Day weekend and do the things we know work when it comes to managing and containing COVID. Thank you. Secretary Sutters?
Thank you, Governor, Lieutenant Governor, Mayor Rigo, Director Phillips. Good afternoon. Over the past week, we've begun regular cadence of meetings with local officials in Chelsea, Everett, Lawrence, Lynn, and Revere. as part of the stepped-up enforcement and intervention initiative. The focus is to step up our targeted efforts in these communities with the highest incidence rates of COVID-19. We are grateful for the strong collaboration with each municipality, their chief executive officer, their police chief and health director, and sometimes some others, as we collectively really lean in to reverse the trends we're seeing, which are high rates and trends far above the state average. Over the last 2 weeks, the statewide average daily incidence rate is 4.2 cases per 100,000 people, while Chelsea is 29.4, Revere is 20.9, Lynn is 12.1, Everett is 15.9, and Lawrence 14.9. As new community data is reported, the Community Engagement and Intervention Team will adjust as cities and towns move into or out of these higher risk categories. Throughout September, the effort will expand beyond the top 5 communities. COVID remains, as the governor has said repeatedly, a serious health issue. It is highly contagious. We must stay vigilant across the state, but particularly so in these communities. In addition to the trends I just cited, case rates in the age ranges of 20 to 40-year-old continue to increase. Formed in August, the COVID-19 Enforcement Intervention Team is leading this effort in these top 5 communities. It's co-led by Secretary Turco and me. The other state team representatives include the Community Tracing Collaborative, the Department of Public Health, the Alcoholic Beverages Control Commission, the Massachusetts State Police, the Department of Labor Standards, and other agencies, all working hand in hand with local officials in these communities, including our good friends from MEMA. This initiative brings even greater focus to the top 5 highest risk communities with regular neighborhood level assessments to determine factors contributing to trends and most effectively use all of our collective resources. It also strengthens the collaboration, which is very strong, between local police and the Executive Office of Public Safety and Security. It includes a multilingual, multicultural public messaging campaign that begins today and will run in each of these communities for the next 4 to 8 weeks. We'll assess progress during this time as well, considering additional communities as warranted, and it will be tailored specifically for the municipalities. This campaign features a new website, as the governor already mentioned, mass.gov/stopcovid19. It's a great resource for residents, business owners, everyone in these communities. It includes an advertising blitz, multilingual community field teams, phone and text communications, and outreach to local groups, all in English, Portuguese, Spanish, Haitian Creole, Vietnamese, Arabic, and other familiar languages in these communities. The campaign's advertising will run on hundreds of displays, message boards, signs, billboards, and other channels in these communities through paid partnerships and via state-owned resources, such as MBTA stations, on mass dot signs, and much more. During this upcoming Labor Day weekend, field teams will be active at approximately 15 locations. While it starts today, all aspects of this campaign will expand throughout the fall. All residents across the state, but particularly so in Chelsea, Everett, Lawrence, Lynn, and Revere, need to stay vigilant. Wear a mask, limit gathering sizes, avoid crowds, and practice social distancing whenever possible. Save a life, wear a mask. We know this is the best way to keep your friends, your loved ones, and neighbors safe and healthy, especially so now. You have the power to wear a mask. If you live in a home with extended family members or a family member with an underlying condition, you should wear a mask inside your home as well as whenever you leave. Let me say this again because it's important. If you live in a home with extended family members or a family member with an underlying condition, you should wear a mask inside your home. Keep in mind, apartment complexes, condominiums, and other multifamily homes have common spaces, mailbox areas, shared entryways, for example. Masks should be worn in these spaces when social distancing cannot be maintained. Today's initiative is one measure to stop the spread, but it is by no means the only measure. We've been at this for a while, I know, as we continue to focus on the hardest hit communities across our state. The administration continues to expand its Stop the Spread free COVID-19 testing across the state. This is a data-driven initiative which started July 10th that provides free testing in 21 communities with the highest case rates. As the governor said, we've provided more than 130,000 tests to residents to date. In addition to Stop the Spread communities, all residents can access a testing site by checking the state's Get Tested website, which includes a map of the 250-plus testing sites and related information. And with that, I'll turn it over to Sam Phillips, who is the Director of MEMA.
Thank you, Governor, Lieutenant Governor, Secretary Setters, and Mayor Arrigo. On behalf of Secretary Turco and the Executive Office of Public Safety and Security, I want to thank everyone, residents and all essential workers whose hard work, sacrifice, and common sense of purpose remain the Commonwealth's first line of defense against COVID-19. You know, at MEMA, we deal with emergencies both large and small. Every emergency or disaster can be different, but they all have one thing in common. It takes partnership and coordination with whole community to mount an effective response during all phases of the crisis. We also know that emergencies can affect some communities more than others. When that happens, initiatives like the COVID Enforcement and Intervention Team are so important. As you've heard, the Executive Office of Public Safety, along with several of its agencies, including the Massachusetts State Police and MEMA, are all members of the Enforcement and Intervention Team, coordinating municipal requests and state assistance, especially in those communities where the risk of COVID remains high. That assistance that the enforcement side can take can be in many forms. It might include additional state police patrols on DCR property, like Revere Beach, or supplementing Brockton with officers to help as they enforce the city's curfew. It might be in Gloucester, where state environmental police joined local authorities to enforce public health orders among boaters on the Annisquam River. And it might be collaborating with ABCC by assisting on-site inspections of gathering limits and distancing requirements. It is not a one-size-fits-all approach. Whatever resources are needed, they are coordinated and delivered in a way that empowers local communities to meet their individual needs. All of us on this team are committed to a partnership that delivers tangible support that bolsters public health, public safety, and public policy in the cities and towns we serve. On behalf of Secretary Turco, EOPS, and MEMA, I want to thank the countless people, communities, and businesses who have overwhelmingly adopted the guidance on face coverings, social distancing, gathering limits, and sanitizing. We've come a long way since April and May, but we can't afford to let our guard down now. Remember, the more focused efforts we are taking to assist communities hard hit by COVID-19 are not just for the benefit of those communities. By working together to drive down cases and stop the spread of the virus, wherever it occurs, it benefits the entire Commonwealth. Mayor Arrigo?
Thank you, Director Phillips, and thank you, Governor, Lieutenant Governor, and Secretary Sutters for having me today and for the support that you continue to provide to the City of Revere during COVID-19. In the month of August, the City of Revere averaged 12.6 new cases of COVID-19 per day, up from an average of 6 daily new cases in July. For the 6th consecutive week, our positive test rate has remained more than 3 times the state average, this week at 5.75%. With data as our guide throughout this crisis, we have suspended all city events and programming until further notice, and all of our students will start the school year remotely on September 16th. Our city shares many of the same characteristics as our neighbors in East Boston, Chelsea, Everett, and Lynn, who are all facing similar challenges as we are. And we are cities of essential employees, frontline workers, many who rely on public transportation to continue to report to work. Many of our residents live in densely populated areas, in multi-generational and multi-family homes. And we continue to see clusters of cases emerge at single addresses. Half of our population is comprised of immigrants and communities of color. We know that this virus impacts Black and brown communities disproportionately, and we are seeing those impacts in the city of Revere. And finally, we know that many of our residents are tired. They're tired of hearing from us. They're tired of restrictions and of the sacrifices that they continue to make to protect themselves and their loved ones. And I can certainly understand where they're coming from. It has been a long 7 months, and it would be easy for us to throw up our hands and give up. But instead, we have to dig in and we have to do more. We have to think of new ways to communicate with our residents. We have to think of new ways to bring awareness to the risk levels. And we have to bring new ways to implement new policies to encourage greater compliance with public health guidelines. We are, and I am, grateful for the continued support of the governor and his team and the support that they are providing to us. And that support has come in the form of expertise, resources, and, of course, autonomy. Autonomy to make decisions that are right for our city and right for our residents. And since the launch of the governor's enforcement and intervention team, we have, in the city of Revere, bolstered our education and enforcement efforts. We are hiring multilingual ambassadors to engage directly with residents in the neighborhood, to distribute masks and be able to provide additional resources to residents that are in need. We've begun issuing citations for private gatherings that violate the governor's revised gathering order. And since we announced the enforcement and mechanism that we put in place, we have seen greater compliance with that order, and we will be obviously monitoring for gatherings closely this weekend, as it is a holiday weekend. We've tightened the capacity limits of our retail and big box stores. We've ramped up our business inspections, and we are hiring additional inspectors to reach hundreds of businesses on an ongoing basis. We've received additional support from the ABCC at licensed establishments and private clubs. We've also begun closing parks and playgrounds where we know that there's continued of non-mask wearing or social distancing. And every weekend, our staff is out at city parks and playgrounds, and they are distributing hundreds of masks. And since rolling out the 2 free testing sites as part of the Stop the Spread campaign in Revere, we are administering more than 2,000 tests a week for Revere residents. That is quadrupling our number of residents being tested since mid-July. And our work in the city moving forward will include all of this and more. Next week, we will launch a regional paid Spanish language media campaign in partnership with the cities of Boston, Chelsea, Everett, and Lynn. We will continue to tap additional state and federal resources to hire more ambassadors, more inspectors, and to fund overtime for existing staff. And as we continue to have access to the entire enforcement team that is laid out today, we know that they will support us in our efforts. We are doing everything within our control in the city of Revere to help slow the spread in our community. But we're also asking our residents to make sure that they do their part and that they make smart decisions. And those decisions are pretty easy. Wear a mask, limit the size of gatherings, practice social distancing, but most importantly, take care of each other. Our residents, especially those that are most vulnerable to the virus, are counting on all of you. Thank you.
Questions?
Governor, we've been hearing from some of these communities for months. What took so long to get this off the ground, the enforcement piece, which obviously is where you're going next?
Well, first of all, there's been work going on in these communities pretty much since this thing was announced. I think at this point in time, between the state police, the ABCC, the Department of Labor Standards, and the Division of Professional Licensure, there have probably been more than 1,000 inspections done across these communities since this effort began. With respect to the citation that Mayor Arrigo mentioned that's being issued to large gatherings where people aren't abiding by the rules with regard to masks and distancing, that came about through a series of conversations and discussions with the folks at the state police and public safety and local law enforcement about trying to come up with a mechanism that would send the message to either the property owner or to the participants in large gatherings where people weren't doing the right thing without actually getting into the business of issuing citations and fines straight out of the gate, because I think the concern with that was that wouldn't necessarily deliver the message people are trying to deliver here, which is you really need to do this. We'll be able to provide you with masks, put them on, wear them. You know, what I would describe as a more collaborative approach to this as opposed to the writing the citation and calling it a day. There's been a lot of traffic in and out of these communities for the past few weeks as we've been working on developing this. The part that took a little bit of time to develop was this actual multi-platform messaging campaign. And the reason for that was we all basically agreed from the beginning that this is something we really need to get right, and it needs to be done in a way that's both language and culturally appropriate, and that it's on the right platforms, and it's going to be getting to the right people, and that we have the right community organizations working with us. There are probably at this point somewhere between 25 and 30 community organizations that we've been talking to. They're going to be part of what I would describe as the messaging campaign, and the folks on the ground who will be talking to and putting up signage in their own locations to help deliver that message in their communities. There's been a lot going on there.
The fact that there's so many of these people who work and live in these communities who are frontline workers, they're interfacing with the public all the time. There's people who aren't complying, but isn't that kind of an underlying challenge there?
Most of the contact tracing so far does not imply or suggest or indicate that work is the problem. It just doesn't. I mean, if you look at most of the data, as we've said several times in this room, would indicate that it's people who are familiar with each other being familiar with each other. That is by far the single biggest issue we face. Now, let me just follow up on that. The mayor made an excellent point when he talked about the fact that people are tired. I got news for you. I am too. So is the Lieutenant Governor, so is Secretary Sutters, and so are a lot of the people who work on our teams. And I know the mayor and his folks are also tired. None of us were brought up anticipating that we would end up living a significant portion of our lives away from a lot of the people that we normally spend time with. I said before that there's a group of about 10 people outside of work that represent the entire universe of the community that I've spent time with and my wife has spent time with since March. And the constant inability to hug people, to engage in any kind of sort of traditional group gathering that we would normally do as a matter of course on a regular basis is psychologically exhausting. But the simple truth of the matter is, and there was a great story about what happens when people don't respect the virus that was in the news recently about a wedding up in Maine. There's 120 people so far who were infected at a wedding that involved 50 or 60 people. When you go to a wedding, the whole idea of distance, the whole idea of masks, the whole idea of all those things is kind of counter to the whole environment of the event. But this is really stuff people need to understand is exactly what COVID wants more than anything else, which is familiarization, close contact, hugging, singing, joy to some extent. And I can't express how important it is for people to recognize, understand, and appreciate that. And a big part of this campaign is going to be about, here are resources we all have that's available, but y'all really need to recognize and understand that the kinds of stuff we do as a matter of course, in many cases, are the kinds of things that create the biggest issues with regard to this virus.
Governor, there's a large group that today they're criticizing you and the mayor of Boston because it was a large party on top of that in Dorchester over the weekend. Went on for 2 nights. They said it was kind of like a Caribbean festival, and that police they called. No one did anything about it to bring help, to intervene. I feel like we're hearing that narrative over and over as far as enforcement goes. Do you have any response to that, or do you even have the resources to crack down on these kind of folks?
So it's funny you should bring that up, because it's my understanding that the state police and the Boston police responded to those calls and broke that event up. I know exactly the event you're talking about. But they did it by going to the event, engaging with the people who were there, and basically working to come up with an answer that would translate into people leaving peacefully. And it took a while. But the BPD was there, the state police were there, and they handled it exactly the way, with all of the tension that's out there these days that exists between law enforcement and people generally, they handled it exactly the way you would want them to. Now, maybe it took too long, and maybe people were unhappy about that. But I know exactly the event you're talking about, and people did show up, and they handled it the way you would have wanted them to handle it if it happened in your neighborhood.
Are you angry, though, that these kind of events are still going on when you stand up in a podium every day saying you don't want to do this?
I'm going to go back to where the mayor was with respect to people are tired. I completely, look, I don't like the fact that so many of my friends aren't part of my life. But we don't do cabinet meetings anymore. We do Zoom calls. And on the Zoom call we did last week with the cabinet, I basically said, look, I miss you guys. I don't like the fact that I never have any sort of informal yakety-yak anymore with a lot of the people who've been part of my life. And I know that's exactly how most people feel. But I also know, and I can't stress this enough, that COVID is all about the contagion. That's what it's all about. That's its superpower. And the last thing we should do is give it opportunities to follow through on that, as frustrating and as difficult as that can be.
Governor, the Scott primary, we had a record-breaking turnout for the primary. Switching gears here a little bit. In Massachusetts, we had some of the highest mail-in ballots. Can you give a comment on the primary?
So I'm old enough to remember the primary in 1990, which was the last time we had a primary like this. I was actually working on Bill Weld's campaign. It was Weld against Pierce on the Republican side and Bellotti against Silver on the Democrat side. And the turnout at that point in time was the highest turnout ever in a state primary. And the reason it was so high is because people felt the stakes were high. And I think that's exactly what we're seeing in this particular election cycle. People believe the stakes in these elections are incredibly high. And people are focused on it, people are paying attention to it, and people want to vote. And I think and I've said this before, I think the legislation that was developed by this legislature with the Secretary of State and with a little bit of input from us, and actually a bunch of input from local officials, was the right way to set up a mail-in program The legislation was developed and enacted, and we signed it before we knew where we were going to be in the fall with respect to COVID, and we wanted to make sure that that opportunity was available to people. And I think the way it got set up, where you have to actually, you get the message in the mail, do you want a ballot or not? You got to sign that you want the ballot. It goes back to your local community. They send you sort of 3 documents: a ballot that looks just like the one that gets put inside the machine, a second envelope that you put your ballot into and you sign it, that you have to sign again, and then a third envelope that actually goes with the address of your local community on it, and your return mail address on it, and that goes to your local community. They can open that envelope, but then they don't open the envelope that has your ballot in it until Election Day, but they can use that to then make the change on the voting rolls with respect to the fact that you asked for a mail-in ballot and that they expect that you're going to vote that way, to deal with some of the issues around harvesting and misrepresentation and all the rest. I think the process Massachusetts put in place was a good one, and I think Election Day basically proved, A, that the stakes are high, that people really want to vote, and that process for many people turned out to be an effective way for them to be heard.
Governor, the CDC has said,
Can I, some of the guys, folks over here? Go ahead.
How are you preparing local boards of health for this large-scale rollout of the COVID-19 vaccine from the CDC? It's my understanding you guys were governors were briefed on that last week.
Yeah.
Also, your comment on the timing of it so close to the election.
All right, I'll talk about the timing, and I'll let somebody who knows a lot more than I do talk about the planning at the state level. I've been on the phone with Moderna a number of times. They're a Massachusetts-based company. I've been on the phone with Pfizer, which is not a Massachusetts-based company, but a lot of the work they're doing on the vaccine is being done up in Andover. And the Lieutenant Governor and I actually visited them. I've also spent time at Beth Israel with the J&J folks who are running a clinical trial at Beth Israel, among other places. The clinical trials associated with this vaccine are typically involved somewhere around 30,000 people. And it is incredibly important that those trials run, that they run the way they're supposed to, that the controls and the protocols that need to be in place are there, and that the results of those trials are factored in any decisions that get made about what happens next. I have no idea how long those trials are going to take, but those trials need to be able to run completely through their course. The data associated with those trials needs to be collected, and people need to then make decisions on what should happen next based on the results of those trials. Those are just the 3 that I know about that are going on in Massachusetts. There are several others that are going on in other parts of the country as well. I think for me, the big issue is that these be done right, and that whatever happens here has what I would describe as a process and a deliberation and a sort of approval that gives people comfort and confidence that this thing is going to be safe and effective. Now, we've been doing safe and effective work in this country as sort of a global leader on new medicines forever. And the last thing we should do at this point in time is change the way these processes work. I know everybody wants to get there in a hurry, and I understand why. And I'm completely sympathetic to why so many people who can't do any of the things they used to do would love to have a vaccine tomorrow. People who like to go to concerts, people who like to go to sporting events. There's a million different people who want to be able to just sort of go back to the life they had. I get why people want the vaccine to be here tomorrow. But we have a tried and true process for developing these sorts of things, and it needs to be pursued according to the rules and protocols and standards that have always been in place before. Let's see what happens with the trials, and then if the trials turn out to be successful, whatever the process or procedure at that point should be going forward can be implemented. But this shouldn't be based on a date. It should be based on a process and a set of protocols that are pretty standard operating procedure in this country when it comes to this kind of work.
Knowing what you know about the trials that are going on, is October rushing it?
I don't know the answer to that, and I'm not going to speak to it. I just want the process and the protocols to be the way they should be, period. And that's what everybody should want. The last thing we should do is do this wrong. Do you want to speak to the way we're thinking about our role in this?
So as you know, we distribute presently about 3.2 million doses of vaccine on an annual basis. So we have a well-established process for distribution of vaccines in the Commonwealth. So we have a good platform, good infrastructure to build from. Knowing that there's been a vaccine in development, not knowing what the timeline was, the Department of Public Health has had an internal working group to ensure that we have the infrastructure in place in the event that once the vaccine is authorized for distribution. McKesson is the federal distributor, and that will be distributed directly to states. And the Department of Public Health will be bringing together people who are outside of government to ensure that we have an equitable lens in the distribution of the vaccine while it's here. So we've had an internal working group working on making sure our infrastructure is in place, and then bringing together, as we have done for both things from the distribution of ventilators to remdesivir and the others, people outside of the Department of Public Health, to ensure that we have a process in place that ensures a speedy and equitable distribution.
What can people expect then? I mean, that's a question.
Is there any sense of who should get this vaccine first in Massachusetts? Do you have thoughts on that?
That's why you put together a working group. It should not be me who directs how this happens, which is why we have a Department of Public Health working group that then brings together a broad cross-section of other individuals from health with a health, and you have to have a health equity lens for this. And I am certain also that the federal government will have requirements around prioritization for vaccines.
Governor, in some communities with few cases where there's some small locally owned movie theaters that say they are not reopening because they rely on food service for a lot of their profits. I was wondering if you could explain the reasoning behind allowing theaters to open but not with food service when there are perhaps restaurants resuming indoor food service.
I think the big issue associated with a lot of this is just around contact generally. I'm aware that this issue has been raised by a number of these folks, and obviously some of them have submitted recommendations, suggestions about how this could be done in a way they believe would be safe. We literally just got those, and we'll certainly take a look at them.
Governor, your reaction to the Boston police overtime alleged thing?
Well, first of all, credit to the commissioner for beginning an investigation on this, and credit to the commissioner for forwarding the sort of early returns on that investigation to the U.S. Attorney's Office. Obviously, the U.S. Attorney's Office, based on their experience with our investigation, knows a thing or two about how to frame and establish a case around what's real and what's not on an issue like this. I think it's a giant, black eye, once again, by a small group of people for a much larger community that I believe tries to do the right thing every day. But if these folks, as we discovered when we did this investigation and forwarded it to the U.S. Attorney's Office in our case, engaged in what I would call theft, then they should be punished for that. I can't hear you.
Sorry. Have you had any discussions regarding mail-in ballots for this week's primary, whether maybe still studying the bill and haven't been counted yet, and what's going to happen with those?
I haven't had discussions about that, but the Supreme Court here in Massachusetts made a pretty declarative decision about ballots, that they needed to be in by 8 o'clock on the day of the election to be counted. And that's been standard operating procedure in Massachusetts for as long as I can remember, and virtually everybody got a ballot if they wanted one on a mail-in by the 25th or so of August. So there was time there for people to execute on this. I mean, I'm one of these people who historically, when I wasn't going to be there for an election, actually submitted a ballot and it got in late and it didn't get counted. I mean, I understand why we have this rule in place. But I think the SJC pretty much spoke to this.
Governor, we've seen a handful of legacy restaurants in the last week close or they're changing hands because of COVID restrictions or the shutdown. Any consideration for relaxing some of the restrictions with the infection rate of those?
So it's sometimes hard to figure out what the root cause of some of these issues. I mean, it all comes back to COVID one way or another, right? But I've been thinking for a long time that the fact that the Bruins were playing in Toronto and the Celtics were playing in Florida was and that their seasons, for all intents and purposes, were basically cut short back in March, was going to have huge consequences for all kinds of restaurants and other establishments that depend on the traffic that's associated with lots of Bruins games, lots of Celtics games, and the aforementioned concerts and stuff like that for a big piece of their business. You also have all the places just around this building, right, that depended historically on the State House being open and people coming in and out as their primary source of customers day in and day out. Those things, some of them they all relate to COVID, but they relate to COVID in different ways. And I think it's heartbreaking to see the way some of this plays out. But if the customers aren't there, then the rules, on some level, really at the end of the day, aren't going to solve the problem. We continue to have conversations with the restaurant community about things we might be able to do to continue to help them going forward. We've advocated for and signed several pieces of legislation that were designed specifically to make it possible for restaurants to find a way to work during this very difficult period. Some of that legislation involved giving local officials the ability to change the way some of their rules work so that they could enhance or expand or put together outside dining opportunities and curbside opportunities and takeout for some of the restaurants in their communities. It stinks. It stinks. A lot of this stinks, but it comes with, it's part of what comes with COVID. And honestly, it's why we've been so aggressive about trying to get this notion across that the most important thing we need to do as a Commonwealth is to beat this thing back. Because the more we beat it back, the more opportunity it is for people to feel comfortable that they can do some of the things they were doing before. The issue with respect to live sports, I mean, the NFL and the NBA and the NHL and Major League Baseball, under the best of circumstances, are playing a completely different kind of game when it comes to crowds and attendance than they were playing before. And that has a ripple effect all over the economy. And the fact that most people don't travel much anymore has huge ripples on our economy. I mean, Logan Airport was doing 450,000 passengers a day before this. Now they do about 50,000. Just think about all the people that means aren't coming in and out of the airport and staying in hotels and going to conferences and going to restaurants and making presentations and the economic consequences of the virus, period, even with things that are open and available to customers, is profound and significant and, in many cases, incredibly distressing.
Governor, you're sending us into a holiday weekend with very bad words for working men for Labor Day.
Pardon me?
You're sending us into a holiday weekend with a very depressing note for the working men. I mean, do you have anything uplifting at all to tell us, anything to look forward to as we get into this holiday weekend?
I think
Sorry.
the best, I mean, look, in the beginning of the summer, we were in a really rough place. I mean, if you go back to May 18th, basically nothing was open, all right? That was the day, right? 500,000 people who weren't working in Massachusetts are working now, who weren't working at the beginning of the summer. All right? Now, that's progress. And we should be proud of the fact that that's happened, because it wouldn't have happened without the people in Massachusetts stepping up every day and doing the things they needed to do to work with us to stop the spread. But we still have a long way to go, and I think it's important for people to remember and understand that.
Governor, you said earlier this week that you were riding the blue line. Were you commuting to the State House? What were you doing on the blue line?
Riding the blue line, just like everybody else does. I rode it into the State House somewhere between 10 and 20 times. I wasn't counting. I wasn't paying that much attention to it in January and February.
Any purpose or any reason you were doing it?
No, none that. No, I was riding the blue line just like other people do.
You stopped us at a number of times that it would make it very difficult for you to do that, because the car, everybody would have to be going like up next to the train. You just get on by yourself?
Yeah.
Just by yourself? No security?
Well, there's a trooper with me somewhere, but, generally speaking, whenever either one of us is in a public place, they give us a pretty wide berth. I mean, I had a few people come up and talk to me, but most people, so the typical reaction was somebody be sitting there. First of all, almost everybody, as you know, is on their phone. Their heads are down. What you see most of the time, if you look around, is the top of people's heads, right? And every once in a while, somebody would look up and they go, and then they just look back down again. It was just the quote in the paper in the story, which was, her reaction was, whatever. That's pretty much what it was, whatever.
Federal unemployment.
Yeah.
That started going out this week, right? The lost wages assistance program. The states that approved for 3 weeks, applied for a fourth. Do you anticipate going forward that you will continue to ask for that federal money?
Look, I think, as I said before, I think there's better ways to do this, and I really hope one of the things that Congress and the administration work on is coming up with a more legitimate way of funding this stuff. Legitimate is probably the word, just a better way of doing it, a way that's consistent with the way they put the program together originally. I do worry about money coming out of FEMA, right? Because a lot of states, including this one, are seeking reimbursement either on our own behalf or on behalf of our colleagues in local government for expenses that were incurred that are eligible for FEMA reimbursement back in March, April, May, and June. But as I said, if this is what's available, we're going to apply for it and implement it and make it available to people in Massachusetts, because in the absence of a better solution, if this is the one that's available, we're going to take it and do what we can to make sure we can serve people here in the Commonwealth.
So you're hoping Congress comes back and comes up with a better plan?
Well, I would just prefer them to. There really wasn't a big debate, as far as I could tell, between the House and the Senate about whether or not to continue a program that was similar to the one that was in place before. The big debate was, what's the dollar amount? They should be able to figure that part out.
Governor,
Thanks, everybody.
Portuguese and Arabic materials be available? I see English and Spanish, but I don't see the other.
There's a bunch.
And they're going to be on the website?
Yeah.
Okay.
Thanks, everybody. Enjoy the Labor Day weekend.